Hi, I'm Lynn Antonopoulos reporting for Daily Bulletin. I'm talking with Dr. Lumarie Santiago in the Department of Breast Imaging at the University of Texas MD Anderson Cancer Center. She is sharing key learnings from her RSNA 2022 education exhibit, 3D Printing and Digital Surgical Rehearsal in Complex Spine Surgery. Thank you for joining me today.
Thank you, Lynn.
Dr. Santiago, how does 3D printing assist with the planning for complex spine surgery?
Well, complex spine surgery often requires multiple surgical specialties working in concert due to the size and critical nature of that location. And 3D printing brings the information to both surgical specialties that are working in one simple, easy to manipulate structure, which is that 3D printed model.
Okay, and how can radiology ensure quality in its 3D printing from multimodality imaging exams?
As you bring about multimodality exams, you have to manipulate the exams, the sequences, to make sure that the anatomical structures that are of interest are aligned properly before you can begin the process of segmentation. This requires us to do the alignment in the software and then check back to different anatomical parts to make sure that everything is aligned properly, including in our case tumor and bone, which is critical for this type of surgery.
And finally, what are some steps that radiologists can take if they would like to incorporate 3D printing into their department?
So I would say that the most critical part of bringing 3D printing into a department is to get as many radiologists and surgeons to the table. This is truly a multidisciplinary effort that makes the radiologists stronger as we understand better the needs and questions that surgeons have, and it also helps surgeons understand what we can do for them to help patient care.
Thank you for your time today. For more information about 3D printing, look for this RSNA 2022 session on demand. And as always, you can find more radiology news at rsna.org/bulletin.